Healthcare officials are meeting the nephrology community in Beijing. They want to find out how home therapy, or PD, can help Asia cope with an increasing number of kidney patients. Peritoneal dialysis is performed as the first therapy choice in Hong Kong. There, and all over Asia, patients on PD are doing well. And besides the clinical outcome, PD is more cost-effective.
Around the world now, we are still seeing that PD is actually much more cost-effective, and that it can be about 1.4 to around 2.4 times less expensive than hemodialysis, the traditional in-center hemodialysis facilities that we are talking about.
In China and Hong Kong, clinical outcomes often exceed those in the Western countries. The average therapy duration of patients in Sun Yat-sen University, Guangzhou, is 35.3 months. The international panel looks at the 2-year patient survival rate of PD therapy. Asian countries are doing well, and Western nephrologists are here to study the Asian examples.
If we can actually increase the current percentage from 10% to 30% PD utilization, we can dialyze 3,500 more people. In Hong Kong, the PD cost is around 2.4 times less expensive than hemodialysis, and we practice a PD first policy.
Unplanned start patients often end up on hemodialysis, not because it's a better choice.
Once they get sick, and especially they don't have time to be prepared for that, they believe that there is a catastrophe and somebody needs to look after them, and that they would rather go to some centers and have people look after them.
The experts panel agrees that more efforts should be done to get more patients on home therapy.
I think that certainly PD is very beneficial to the patients, and it would be a shame this modality is not given to the right patients.
In and around Beijing, there are some excellent examples of PD training centers. The biggest one, at the Institute of Nephrology, has almost 700 patients. 84% of them can survive thanks to PD.
在我们中心呢，我觉得我们之所以能够成为亚太最大的腹膜透析中心，第一，中国有非常多的这个终末期肾衰竭的病人等待透析。第二个呢，就是我们有一个非常好的高效的工作的腹膜透析的团队，那么包括我们的医生，包括我们的护士，他们工作非常努力，也非常高效。第三，就是我们的病人也得到了一个比较好的透析前的教育，所以在选择透析治疗方式的时候，我有50%以上的病人选择腹膜透析，这是我们成功的非常重要的因素。
In Thailand, the government introduced a PD first policy. If a patient chooses home therapy, extra government funding is made available. The Thai authority participates in the debate, showing an increase in PD choices now that home therapy is fully reimbursed.
We have a universal coverage. So the major philosophy of this universal coverage is to prevent catastrophic illness. And in Thailand, the health infrastructure is really suitable for service the chronic care like as CAPD.
The debate allows Asia and Western countries to learn in both directions.
How did you educate your government to initiate those policies?
As you know that in Canada, a lot of the medications are free. And when you're looking at medications, the government has a policy. If the two drugs are equally effective, there is no reason for them to reimburse you for the more expensive drug.
Meetings like this one are vital. It's mostly the nephrologist or the nurse who provides the crucial information to a patient.
They always ask the doctors and the nurses what kind of treatment I should get and which one is better. So actually those selection are affected very much by the doctors and the nurses.
With the number of kidney patients rising fast in the Asia-Pacific region, there is a shortage of training and education for nephrologists and nurses.
PD is very much different compared to hemodialysis. PD is a home-based therapy. The patient are responsible for their own dialysis exchange, own treatment. So we need to change our concept of how to treat our patient. We need to teach our patient, to educate our patient. So education, both for healthcare professionals and the patients, are very important in the PD treatment.
All agree that these investments would be beneficial. Shifting to more PD saves money. More patients can be treated. PD in Asia Pacific has excellent clinical outcomes. But more training is vital.